This is an image of a person. Although there is no obvious defect or problem, but as overall it is not normal. We will know the reason quite soon. This is an image of a young boy where we can find that the external ear is not well formed, the lateral angle of the eye is depressed, and the mandible is small. This is a person where you can find that there is a large swelling just posterior to the sternomastoid. This is a cyst, a result of a problem in the development of the neck. Another case of a quite large cyst on the side of the neck. The reason is a fault in the development of the neck. This lady is having quite a large cyst at the base of the neck. This person is having a scar because of an infection of a cyst in this area. This person is having a swelling exactly in the midline of the neck. This person, when he or she opens the mouth and protrudes the tongue, we can see that there is a red mass at the posterior 2/3 of the tongue. The story here is the maldevelopment of the thyroid gland. This lady has quite a large tongue because of a problem in the development of the tongue. This person has a short frenulum of the tongue, therefore the pronunciation of words and letters will not be normal. We have seen a group of conditions which are related to development of the neck. This is a diagram showing that the pharynx is within the pharyngeal arches, and these arches are receiving very important contribution from the neural crest cells. The neural crest cells, as you may know, are a group of cells that develop when the neural tube joins and closes. Sideway cells will develop, and these are the neural crest cells. This is a CT scan image of a lateral view of developing embryo. Now, when you were watching the previous lecture, you know that these are the pharyngeal or the branchial arches and clefts. This is a computerized CT scan image of the head of an embryo, where you can see that this is the frontonasal process, and this is the first arch which is branching into the maxillary process and mandibular process, and this is the second arch. This is the place of developing heart. This drawing represents the presence of the pharyngeal or the branchial arches. It is numbered 1, 2, 3, 4 and 6. 5 is missing in the human. Now let's write remarks about what we have seen. Humans have 5 arches: 1, 2, 3, 4, and 6. There is a missing number 5 which is not developed in the human. Face mainly developed from arch 1 and 2, which we have seen already in the previous lecture, and the neck components will develop from arch 3 and 4. Arch 4 which is going to fuse with arch 6. This is a front view of scanning electron microscope view of the head, where you can see this is the first arch with its maxillary and mandibular branches. This is the second arch, or the hyoid arch. This is the third, and this is the fourth arch. This is a scanning electron microscope of a cut section through the arches. Here is an arch, the core of an arch, and between an arch and another, on the inside there are pouches like pockets, and on the outside there are visible clefts between an arch and another. And this is the arch on the inside. This is the endoderm of the arch extending to the next arch. This is the ectoderm cells extending to the next arch through the clefts, and the core of the arch has a mesenchyme. This is the superficial part of the endoderm, and this is the superficial part of the ectoderm. This is a drawing showing the circles representing the pharyngeal arches, lined on the inside with an endoderm and on the outside with an ectoderm. The mesoderm in the middle usually contains an artery, a vein, a nerve, and a cartilage. The place between one arch and the next is composed of only ectoderm, endoderm, and a little mesoderm in between. This drawing shows that there are 4 arches in the human. Depressions on the outsides are called clefts or grooves. Depressions between arches on the inside are called pouches. Each arch contains a nerve supplying structures developing from this arch, a cartilage supplying the skeletal structures developing from this arch, and an artery derived from the aortic arches. Now, let us remember a few facts about the pharyngeal arches. There are 5 U-shaped bars of tissue below stomodium, the mouth, and branchial or pharyngeal arches. They develop from neural crest cells. Now, because the 4th and the 6th arches are fused, sometimes they are referred to as 5, but actually they are present as 4. Branchial arches or pharyngeal arches. They are only transitory because they soon develop into different structures. They don't persist, and an arch is a mass of mesoderm plus covered by ectoderm on the outside plus lined by endoderm on the inside of the pharynx, and they develop muscular tissue, skeletal, aortic arches are present, and nerve networks. Now, in the interior, the space between an arch and the other is called a pharyngeal pouch. On the surface, a depression separating the arches. These depressions are called grooves or clefts. This is a scanning electron microscope of an embryo where we can see the first arch dividing into a maxillary process and a mandibular process. Let us write down some remarks about the pharyngeal arch 1. It has a mandibular process and a maxillary process. These will develop into anterior 2/3 of the tongue, teeth, Michel's cartilage, which is a cartilaginous bar that will develop into the mandible, most of the hard and soft palate, as we have seen in the development of the face, internal auditory tube, and the ossicles, the 2 ossicles of the middle ear, the malleus and the incus. This is the first arch. We can see that it develops part of the external ear, the malleus and incus, part of the mandible, while the second arch develops the stapes, the 3rd ossicles, most part of the greater wing of the hyoid and upper part of the body of the hyoid bone. Therefore, this is called the hyoid arch or the facial arch. Arch 3 contains is the lower part of the hyoid bone. Pharyngeal arch 1, the mandibular process is supplied by aortic arch 1, the facial artery, the mandibular division of the trigeminal nerve, the V3 as nerve supply. a view of scanning electron microscope of the head, where you can see the maxillary and the mandibular branch. This arrow points at the second arch. The second pharyngeal arch, also called the hyoid arch, will give origin to posterior one-third of the tongue, upper part of the hyoid bone, styloid process of temporal bone, stapes of middle ear, platysma, palatine tonsils, Reichert cartilage, and muscles of facial expression. Pharyngeal arch 2, its artery is the external carotid artery, and its nerve is the facial nerve. This arrow is pointing at the third pharyngeal arch. Pharyngeal arch number 3, named as thyroid arch, is going to develop into a share in the posterior one-third of the tongue, lower part of the hyoid bone, superior part of the parathyroid gland, stylopharyngeus muscle, and its artery is the internal carotid artery, and its nerve is the glossopharyngeal nerve. This is a scanning electron microscope of an embryo, and the arrow indicates the pharyngeal arch number 4. This is fused with number 6. Here is a summary about pharyngeal arch number 4. What is its name? It is unnamed because it is much less clearly differentiated, and it develops into cartilages of the larynx, cricothyroid muscle, inferior part of the parathyroid gland, supplied by aortic arch number 4, and the external branch of the superior laryngeal nerve of the vagus, that is the nerve supplying structures developing from this arch. There is no harm in reviewing the overall picture of the pharyngeal arches with nearby structures. Mind you, pharyngeal arch number 5 has no name, and it is never seen in humans. This is a drawing of a cross-section of the pharyngeal arches. This is the first cleft on the outside, which is going to develop into the external auditory meatus, and this is the first pouch on the inside of the mouth, which is going to develop into Stachan tube, and these are the clefts below the first. This is the second, third, and the fourth. Now what is happening is that the ectoderm of the second pharyngeal arch is going to grow and obliterate these clefts. Sometimes there is a small lumen leading to this space. Let us write down a few remarks about clefts and pouches. The first pharyngeal cleft is the only one to persist, and it is going to form the epithelium of the external auditory meatus and part of the tympanic membrane. Now, at the external orifice of the external auditory meatus, there are swellings. They are arising from arches, mandibular one and the hyoid second arch. They participate in the formation of the external ear, and that is why we have multiple nerve supply of the external ear. These are two drawings of the pouches and clefts. Here we can see the first pouch between the first and second arches, and if we look here at this side between the first pouch and the first cleft, now the first pouch will extend laterally to form Eustachian tube and middle ear cavity, and the external or the first cleft will form the auditory tube. Let us see some details about the first pharyngeal pouch. From the inside of the pharynx, this is going to elongate laterally to form the tubotympanic recess or the Eustachian tube, and then expands to develop the middle ear cavity and bones. Distal portion will reach the first pharyngeal groove and forms the tympanic cavity and the mastoid antrum. The remainder will form the Eustachian tube. There is fusion of ectoderm and endoderm, and this fusion will form the tympanic membrane. There are two figures of coronal sections of the pharyngeal or branchial arches. Now, inside this circle, we can see that the ectoderm of the second pharyngeal arch grows down, obliterating the clefts below it, and there is a single opening. This single opening, when it closes, it creates a cyst, and this explains the cysts we saw in the necks of people in the first few slides. Few remarks about pharyngeal clefts, the grooves between the branchial or the pharyngeal arches on the outside. They start to be seen at week 5, and then they almost completely disappear. Second, third and fourth clefts are overlapped by development of arch2, its ectoderm, and form a space. This space is called cervical sinus, and this cervical sinus should disappear during extension of the cervical flexure. let's refer again to the cleft between the first arch and the second arch. Let's look at the malformed pinna of the ear. Above the yellow line, this area created by ectoderm of first arch, having several tubercles forming the superior part, and the area below the yellow line of the pinna of the ear develops from the ectoderm of the second pharyngeal arch. Back again to the coronal sections of pharyngeal or branchial arches. The first pouch, which is going to extend laterally to form Eustachian tube and middle ear and some of its contents. The one below it, between second and the third, is a depression. This is going to be the tonsillar fossa, and then the one inferior is going to have two wings. The superior one is going to develop the inferior thyroid gland, and the inferior one is going to develop the thymus. And the last pouch also bifurcates into two wings. The upper one is for the superior parathyroid gland, and the inferior one is for the ultimobranchial body, which will form the parafollicular cells of the thyroid gland. Now, in the figure to the left, this is the tonsillar fossa, and this is the inferior to it is the inferior parathyroid gland and thymus, and the last one will develop into superior parathyroid gland and ultimobranchial body. Now let's write some notes about pharyngeal pouches. They are balloon-like diverticuli of pharyngeal endoderm on the inside of the pharyngeal cavity. They lie between pharyngeal arches on the inside. 4 will be well-developed pairs of pouches. The 5th pair is rudimentary or absent. The pouch endoderm reaches the branchial groove on the outside, which is made of an ectoderm. Now, to form the double layer of ectoderm and endoderm, this is called branchial membrane that lies between the space between the different arches. These are the two openings of the Eustachian tubes in the nasopharynx. They represent the beginning of the developed first pharyngeal pouch. Let's see some details about the second pharyngeal pouch. This pouch does not elongate as much as the first, because the first forms the Eustachian tube and the middle ear, and the second one will form the tonsillar fossa, made of endodermal epithelium. This is going to be invading the surrounding mesenchyme to form the palatine tonsils. This tonsil is gradually infiltrated by lymphatic. This is an image of the two palatine tonsils present in the tonsillar fossa. The fossa is made by the second pharyngeal pouch and its framework. The lymphoid tissue will come later on and invade this area to create the real tonsils. In the figure to your left, here is the palatine tonsil in the second pharyngeal pouch. The third pharyngeal pouch is going to have two branches. Superior one, the green one, is going to develop into the inferior parathyroid gland, and the lower one is going to develop into thymus gland. Here are some notes about the third pharyngeal pouch. It has a ventral wing and a dorsal wing. The ventral wing will form the primordium of the thymus gland, which proliferates plus obliterates its cavity, and it migrates to form a single median gland. It will come down, lose its pharyngeal connections. Now the dorsal wing will form the inferior parathyroid glands, which migrate as well to the thyroid gland and lose its pharyngeal connections. The fourth pharyngeal pouch will form the superior parathyroid gland and ultimobranchial body. Let's remind ourselves with some facts about the fourth pharyngeal pouch. It has a ventral wing and a dorsal wing, just like the third. The ventral wings on both sides will give rise to ultimobranchial body, which are going to form parafollicular cells, or the C cells of the thyroid gland. They are totally of neural crest origin. The dorsal wing will form the superior parathyroid glands. They come down towards the thyroid gland on the posterior side of the lobes and lose their pharyngeal. This is a posterior view of the thyroid gland, and here you can see the superior parathyroid gland on both sides and the inferior parathyroid glands. These are in a common position, but they can be in abnormal positions as well. These are a few choices of what is called ectopic positions of the parathyroid gland. They can be in the carotid sheath and they can be intrathyroid. They are usually outside the capsule of the thyroid, and they can be retropharyngeal, a difficult position to reach behind the pharynx, and retroesophageal, also a difficult position and can be in mediastinum, and they can be in the thymus. Now it's your turn to study this corona section of the pharyngeal arches, pouches and clefts. This is a view of the tongue showing the anterior 2/3 and the posterior 1/3, where one can see the foramen cecum, where the development of the thyroid gland starts. This is the pathway of descent of the thyroid gland. It starts at foramen cecum, passes through the material of the tongue between anterior 2/3 and posterior 1/3 in front of the hide. Now as the thyroid goes down to its final position, its connection with the tongue remains as a canal. Sometimes this canal is not closed at certain areas and develops a cyst called thyroglossal cyst. It is exactly in the midline, and to be sure of that, ask the patient to protrude the tongue, and then this swelling will rise up. This is a diagram showing that a cyst can develop in the middle of the way of descent. This is the starting point of the formation of the thyroid gland. This person has a reddish swelling between the anterior 2/3 and posterior 1/3 of the tongue. This is the pathway of descent of the thyroid gland, and this is the one of sites of developing thyroglossal cyst. Let's write down some remarks about developing thyroid gland. It begins developing about 24th day. The starting point is floor of the primitive pharynx, caudal to the tuberculum impar of the tongue as an endodermal thickening, and forms a downgrowth which is called thyroid diverticulum, grows into the underlying mesoderm. The diverticulum descends into the neck. In front of the neck, the diverticulum is connected to the tongue by a narrow canal. This narrow canal is called thyroglossal duct. Opens in the tongue via the foramen cecum. This diverticulum grows rapidly and forms the two lobes of the thyroid gland and reaches its final position anterior to the trachea. As the thyroid gland reaches its final position in front of the trachea in the form of a small median isthmus and two lateral lobes, by then the thyroglossal duct usually has disappeared, losing connection with the tongue, plus there will be a pyramidal lobe extending from the isthmus, seen in about 50% of thyroid glands. It is derived from the lower part of thyroglossal duct. Here is a basic idea about formation of the tongue. In arch 1 there will be two lateral swellings, lingual swellings, and small median one in front of foramen cecum. In arch 2 there will be a swelling called copula. In arch 3 there will be the hypopharyngeal eminence compartment shared between arch 3 and arch 4. Now in arch 1 there will be lateral lingual swellings, two of them, and tuberculum impar, a small one in the middle. That's what's happening in arch 1. This is going to form the body of the tongue. In arch 2 there will be little share, but later on it will disappear. In arch 3 there will be the root of the tongue posterior to foramen cecum. In arch 4, of course, the structure posterior to the tongue is going to be the epiglottis. Let's have some notes about development of the anterior two-thirds of the tongue. These are derived from the median and lateral tongue buds. They arise from the floor of the first pharyngeal arch, two overlateral lingual swellings, and there is one median triangular swelling called tuberculum impar, and two overlateral lingual swellings. These two lateral swellings will increase in size, plus they merge together and overgrow the tuberculum impar. These buds are then invaded by occipital myoblasts. Now, the posterior one-third of the tongue develops from swellings of third and fourth pharyngeal arches, two elevations, a median one, this is called the copula, plus a large hypopharyngeal eminence. Now the copula is overgrown by the hypopharyngeal eminence and disappears. That's the copula, plus fuse with the anterior two-thirds of the tongue. Overgrow the second arch. There is no contribution of second pharyngeal arch. Intrinsic muscular muscles also derive from occipital myoblast, fusion of the anterior two-thirds and posterior one-third.